Good evening, and welcome to another episode of Scientific Musings with Tope. We are still trying to deal with the coronavirus 19 epidemic. And so I thought I'll give a bit of an update, especially with so many different variants running all around. We've heard about the Delta variant, the Beta variant, the Lambda variant, I'm sure some of you guys have heard about as well. And, we know that this pandemic has pretty much affected our lives, families, economies, human beings. We've lost a lot of lives, we've lost a lot of quality of life as well as a result. And I'm sure, quite a few people have been wondering or may not understand the epidemiology of this disease or this virus and pretty much the timeline with which it has its effects. And I thought I would just give a bit of a tiny breakdown of that and just try and explain some of the methods that are currently being used to manage it. That way we can get a bit more of an understanding of how the virus works and how the timeline of infection works. First of all, we know that obviously there are more infectious variants going around out there. The reasons why we have to continuously wash our hands, sanitize, and avoid touching our face, the reasons why we're wearing our masks, is specifically because the virus spreads within droplets, bodily fluids, if you could put it like that, specifically fluids coming from your nose and your mouth. We know that you can come into contact with the virus by either inhaling droplets from the air or by touching droplets and touching one of your mucous membranes, say your eyes, your nose, or your mouth. So, like most viruses, we know that COVID-19 cannot survive on its own. It needs a host cell to survive. And so upon contact, what it does is it infects the epithelial cells that line your airways. A lot of the times it starts right there in the throat. And what it does is it invades those cells and then takes over the replicative or the reproductive machinery within the cells and utilizes that to replicate or reproduce itself. Now, we know that these viruses have a much quicker life cycle than we do. And so you end up in a situation that within a couple of days you go from having a few thousand of these viruses to millions within the body, because they've taken over the cells within your airways and they've started to replicate. And so how does the body respond to this? A lot of the times, and I'll try and draw parallels here to when people have the flu. I've heard so many people say, oh geez, I have the flu, I'm going to the doctor, I need to go get some antibiotics. Now you will see how much of an irony that is, because antibiotics, as the name implies, are antibacterial. So your antibiotics are not necessarily going to help defeat the virus. What actually defeats the virus is your immune system. And how does this happen? The virus begins to replicate, right? It begins to go from hundreds or from thousands to hundreds of thousands to millions. Now, like most cells, the virus has protein structures that surround it, or that are part of its shell. Now, these protein structures, and generally known as antigens, are pretty much the identification factors for these viruses. Now, these antigens or these protein structures can be recognized by certain molecules within your body. Now, this is specifically known as antibodies, and that's why when you hear people talk about the vaccine, you hear them talking about antibodies. Your body recognizes that there's something foreign within it, and so it is able to create antibodies that recognize the virus and attack the virus, as well as activate your immune system and get your immune system to target and attack the virus as well as the cells that have been infected by the virus. And now this generally, takes a bit of time. You would have noticed that, there is that generic time frame that's given by everyone, quarantine for 10 days. Why do you get asked to quarantine for 10 days? Unlike the flu, we know that, on average, the time between contact and the initial activation of the immune system is about 5 days. Now, the problem is, right now, with variants such as the Delta variant, most people don't even know where they came into contact with the virus, so it's almost impossible to know day one. Remember, day one is not necessarily when you get your positive test, because you could have come into the contact with the virus about 6-7 days before a positive test is received. As such, day 1 is assumed to be when you get your first symptoms. Now remember, between the day of contact and the day of first symptom, you generally have about 5 days in between. So you understand that your day 1, which is the first day of feeling a symptom, is probably about 5 days after you were first in contact with the virus. So what a person can do when they feel a bit of a symptom is to just note that down in the diary. I felt a bit of a sore throat on this day, or I felt a bit of a headache on this day. And so what happens after that first day where you feel the first symptom is that the body's immune system gets activated and the immune system starts to fight the virus. You have a whole bunch of different structures that are activated. Your antibodies get activated, the rest of the immune system get activated. You also have the production of cytokines, inflammatory cytokines. These are molecules that serve as messengers within the body. And what they do is they increase inflammation. This leads to an increase in some of the symptoms that you feel. You start to feel body aches, you start to have headaches, and you have a bit of an elevated temperature or fever. A lot of this happens as a result of the increase in inflammatory cytokines. But all of this is normal, all of this is good, because what's happening is that your body is attacking the virus. And so you generally manage this 5 days by giving your body the tools to fight the virus, vitamins and the likes, as well as managing your symptoms or treating your symptoms. And for most people, after those 5 days post first symptom, the body is able to overcome the virus, and that is the end of their ordeal with COVID-19. To some people, it may be a bit longer, and the body is able to overcome the virus, but some of the symptoms may slightly persist, but they gradually get better over time. And that's the reason why generally you're told to quarantine for 10 days, because it's believed that from day 1 to day 5, that is your initial contact period. From day 5, your initial symptom, to day 10 is usually when the immune system response has been able to overcome the virus. However, we know that with a small percentage of people, it doesn't end there. And what happens is you have a secondary phase of the disease. So what happens with these people is that they have that day 1 to day 5 of the immune response. After that period, rather than the symptoms either disappearing or reduce, you have a situation where the symptoms either get exacerbated, they get worse, or they reduce for a short while and then come back again with full force. And this is generally known as the initial red flag, or the beginning of the dangerous phase of the disease. But why does this phase happen? It will obviously be a bit apt to think that this person has had the initial contact, they've had their initial symptoms, and they've had their initial immune response. And you would think that what's happened is they haven't been able to get rid of the virus, or the virus has come back. But most of the time, by this time, the virus is actually gone. And this second phase is governed by something known as an inflammatory storm or cytokine storm. Now what happens here is you have a secondary activation of the immune system. The secondary activation of the immune system happens because the virus's antigens are slightly similar to the recognizing factors on some of the cells within the lungs, blood vessels, and other major organs. And so what happens here is that the immune system becomes confused. And you go from a situation where the immune system was initially attacking the virus to the immune system seeing its own cells as either the virus or thinking they're infected by the virus. And now the immune system begins to attack the blood vessels within the lungs and other organs. This inflammatory storm, or the cytokines, are upregulated again, or they're increased. When they get increased, you have a situation where those symptoms come back, because now the cytokines are back, the fever is back, all of those other symptoms come in, the body aches and the headache. Generally they come in a little bit worse, and that is one of the red flags that one wants to look for. So once this happens, you know that the body is starting to attack itself. And because it's attacking the blood vessels within the lungs, you have a situation where the exchange of oxygen between the alveoli of the lungs and the blood vessels is compromised. This is one of the reasons why you have that drop in oxygen saturation. Another thing that tends to happen is an increase in blood clotting, because obviously there's damage, and this damage can also cause blood clotting. Now this phase is, as I said, the dangerous phase, or the red flag phase, and it's generally managed within healthcare by the use of molecules known as anti-inflammatories, generally anti-inflammatory steroids. One specific one that I can talk about is one known as cortisone. Now what you have in this situation is that, because we know that this is as a result of a secondary activation of the immune system, you try to mute the immune system, and you use this by using these steroids to shut down the immune system's response. As you can imagine, timing plays a strong role in this phase, because within your initial immune system response, you want your immune system activated, but in the secondary response, you don't want it as activated, because now it's attacking your own cells. So you want it activated when it's attacking the virus, you don't want it activated when it's attacking your own cells. So it's one of the reasons why you can't self-treat this. You need to be in contact with a doctor. Yes, it can be treated at home, but your doctor needs to help you with your timeline. And so you have a situation now where you try to mute the immune system's response to prevent it from attacking its own blood cells. This generally happens for about 10 days. And you also need to try and control the blood clotting. And so your doctor would also prescribe something known as anticoagulants, this are blood thinners. They help to prevent or reduce clotting. This is generally done for about 3 weeks, because the clotting seems to be an issue for longer than, just the initial inflammatory storm or the cytokine storm. But as you can imagine, if you are shutting down the immune system, it also opens a window for opportunistic infections, opportunistic bacteria and the likes. And so generally, about a couple of days, maybe about 5 days after you've started with your anti-inflammatories or your steroids, or what the doctor will do is put you on antibiotics, because you are trying to prevent opportunistic bacteria from causing or taking advantage of your muted immune system. This is done for a period that is recommended by a doctor, and it's something as well you don't want to jump the gun with, because you do not want to build bacterial resistance. And so we know that your initial contact, or a person's initial contact to the first 5 days, is the replication period. From 5 days to 10 days, it's usually the initial immune response. Beyond 10 days is the secondary phase, if the symptoms get upregulated or if the symptoms increase. Now you know that at this phase, the doctor will recommend 10 days of anti-inflammatories, and then also recommend anticoagulants. And this is used to manage the cytokine storm, as well as manage the blood clotting that could cause issues at the end of the day. Generally, when all of this is done perfectly, person is able to recover. But you have situations where people miss these time points. And obviously we know that with certain people there is a reluctance to, ask for help or go to a doctor and stuff like that. And as a result of that, one can miss the time frame. And when a time frame is missed, you have a situation where the activation of that cytokine storm is missed. And by the time you are starting to address it, the storm has almost gotten out of hand. And that's when you tend to have very severe cases, and people end up in situations where they're in hospitals and ventilators and the likes. And that's because by this time there's so much damage that's been done to the lungs. And as you can imagine, if a person is isolating, there's a huge chance that they're not doing much activity. They're using only the active capacity of their lungs. So they may not necessarily notice that their lungs are getting damaged. Or by the time the oxygen saturation levels drop, there's a huge chance that a lot of the lungs have been damaged. And that's the reason why people seem to struggle, even after recovering, for extended periods of time. And so it becomes important to understand your timelines, to understand that if after your first day of symptoms, if 5 days after you feel good, and for the next few days after those 5 days you feel good, you're good, you've recovered. If there is an increase in symptoms beyond 5 days, you need to talk to a doctor, and generally let them know the timeline, and then your doctor can get you on the anti-inflammatories as well as the anticoagulants. You know, when everything is followed to the T, people generally end up okay. Hospitalization tends to happen when one misses those cues, but as long as you're able to stick to those cues and understand how to monitor a timeline or monitor the timeline, you are generally in a place where you give yourself a better chance of defeating the virus. Now again, all of these processes should be done in consultation with a doctor. We know that people with comorbidities, as a result of their comorbidities, have it a lot harder and struggle more with the disease. That's due to the fact that, you know, the anti-inflammatories sometimes can increase the effect of these comorbidities, say in cases like people who have diabetes. And just the fact that these people already have organs that are vulnerable, when the body starts to attack itself, this can escalate the situation. But generally, if you are able to notice these timelines, you're able to manage it better, you know that for the first 5 days, you equip your immune system, you have your vitamins and the likes, and you generally would be fine. For about 20% of people, it doesn't work out that way, and after that they have an escalation in symptoms, and within these people they need to go on the anti-inflammatory and anticoagulant in combination with antibiotic regimens, and generally once this is done the right way, they're able to recover. So I hope this video has been a little bit informative, it's been a little bit educating, and helped us to get a bit of a better understanding as to how, you know, the coronavirus disease timeline happens, and just gives each one of us a bit of a better chance at, or equips each one of us with a better chance at defeating it should one get in contact with the virus. I hope you guys have enjoyed the talk, and you can definitely ask me any questions in the comments. I'm happy to take them. And yeah, I hope you guys have a great rest of the month. Please stay safe, keep sanitizing, wash your hands. Prevention, as we say, is always better than cure. Eventually, you know, once all the vaccine issues are fine-tuned, we will be able to get out of the storm. But until then, keep safe. Catch you in the next video.